morning, everyone. Welcome to our Meet the Media training, Communicating Health Information and Media Advocacy. We're so delighted to have Carlos Delgado, Senior Media Relations and Public Information Officer, Rady Children's Hospital. Before we get started, I want to go over a few housekeeping items to make sure our training goes smoothly. The training will go from 10 to 11. We can have some time if it goes over that till 11:30. The training is being recorded. Today's session will start off with the speaker's background, a presentation, and then the remaining time will be for open dialogue and Q&A. We ask that you hold your questions until the end of our speaker's presentation to keep the session conversational. We would love to have you raise your hand if you have a question for our speaker. Our team will call on you to unmute in the order in which you appear. If needed, you may also place your question in the chat for our team to present to the speaker. And we look forward to an engaging session with all of you today. With that, I would like to introduce Carlos and just give a little bit of background on Carlos. He is an award-winning and accomplished bilingual communications professional. Carlos Delgado has more than 2 decades of media relations, crisis communications, issue management, media training, social media and television news experience. Carlos is a highly skilled professional leader who directs high-level media relations, crisis communications, and social media efforts for Rady Children's Hospital San Diego, ranked as one of the nation's top pediatric healthcare systems. Carlos has an impressive track record of consistently driving excellent results for both local and national media placements to promote the mission of Rady Children's. His work has resulted in 6 top awards from various recognized public relations and communication groups in Southern California region. I just want to go over some of the accomplishments because there are many. Among some of his accomplishments, he was responsible for leading the hospital's media efforts during COVID-19 pandemic, garnering hundreds of earned local, national, and international print and broadcast placements. As a television reporter, Carlos worked for English and Spanish language networks across the country. Carlos uses his extensive experience in television news to serve as a media trainer and crisis communication instructor for the California Specialized Training Institute. And I can go on and on. We're so happy to have Carlos now. If there's anything I missed, I want to hand it off to Carlos now.
Like you said, Joe, a lot of experience. But thank you, Joe and Sarah and team, for having me here. I just got back from doing a crisis communications training up in Solano County in Long Beach and San Bernardino just a few weekends ago. But thanks again for having me. Again, my experiences in media relations and crisis communications training. And today we're going to be talking a little bit about media and social media and how I sort of tackle it to really help promote Rady Children's. And there's some videos that I want to talk about. And again, feel free if you have a question during the presentation. I see some familiar faces on here. Paul Levico, good to see you, and some other folks that I know that I've worked with closely. And I've worked with Joe doing some media relations through Rady Children's. So that's how I connected with Joe. And I thought this would be a good opportunity to really talk about media and social media. So with that said, let's get started. Joe, thanks for the introduction. Again, I'm Carlos Delgado, and I'm the Senior Public Information Officer at Rady. I've been at Rady for 17 years now. Wow, I can't believe, Joe, that's a very, very long time.
Time flies.
So what is earned media? So that's what I do primarily at Rady Children's. We don't really do a lot of paid media, but it's earned media that we do. So it's basically getting exposure for your agency without having to pay for it, right? So some of the methods of really obtaining some earned media would be writing a press release, a media advisory, conducting a press conference, directing pitches to news outlets and reporters and writers. For example, I work closely with Paul Levico at the Union Tribune. He's a healthcare writer, so we have established a relationship over the last 15 years, and we normally just now pitch via email. We don't really pitch news releases to him. It's more, Paul, we have this great story. Would you like to cover it? So depending on who you work for and the organization and the focus on what you do, it's always a good idea to establish those relationships with those reporters based on, the programs that you work with. Sometimes even pushing stories through social media is very helpful. I can tell you a story of a few years ago. I did a story about our volunteer program and focused on this 92-year-old volunteer at Rady Children's and posted his great picture and the work that he's doing at Rady Children's. And Sure enough, Fox 5, one of the anchors, Andrew Luria, saw it and said, "Hey, I want to do a story on this guy." So sometimes pushing some of the great work that we are all doing within the community and put it on social media can also attract attention uh, from news media outlets. It's always a good idea to sometimes even tag him if you're a social media expert in doing social media, to put that out there to see if you get any bites, as we call it in the TV world. Here are some of the stuff that I have worked on just recently. We're potentially merging with Chalk of Orange County, or Chalk of Orange County is merging with Rady Children. So that's a recent story that we did with Paul Sisson at the UT. There was a recent story, the partnership that we have with our Chadwick Center. Our Chadwick Center at the hospital is working with child abuse cases and so forth, and we have a partnership with the San Diego Police and law enforcement. So that was a story about Lyle, who is the canine that works with these families. So we were part of that story. And then last year, I did a big front page story in the UT about the shortage of blood for children and babies in our NICU. So that was, as you can see, the story. And all of that was just sort of earned media that we didn't have to pay for. Just sending out a news release and or an email, a media advisory to Paul Sisson at the UT to get some coverage, and it really helped. Earned media also plays a role in television. We sent a bunch of kids to spring training with the partnership with the Padres a few weeks ago, and I want to share this clip that NBC picked up on.
Okay, so the Padres spring training games have now started, as you probably know, and this weekend there will be some special fans in the stands.
Instead of spending the weekend in the hospital, 16 young people who received cancer treatments at Rady Children's are in Arizona to hang out with the Padres. NBC7 photojournalist Elroy Spatcher was at Petco Park today for their big send-off.
Well, it's an exciting day. We're taking a group of kids from our Peckham Cancer Center that are undergoing cancer treatment. You know, they're going through treatments and a difficult time in their lives, but they get to come together. A lot of them really don't know each other. This is the first time they've been together, and they're going without their parents.
This is awesome, bro. I'm excited to go to spring training because I'm excited to meet those San Diego Padres because I'm a big fan.
Awesome, and that is for you.
So I have a blood disorder called thalassemia, and that means that my body doesn't make enough healthy red blood cells. So I have to get blood transfusions every 2 weeks to keep my body healthy.
So this is one of my favorite days of the year, and our players are going to spend time with them. They'll go to Dave & Buster's tonight and play video games, and then they're going to get a special behind-the-scenes tour of our spring training complex tomorrow, attend our game, stay at a resort over the weekend, and just, at least for 48 hours, be normal teenagers.
I'm excited to travel without my parents and go to Phoenix. It means a lot because I'm usually like stuck in the hospital because of my blood disorder, and it means a lot that I can like go outside the hospital and get to travel and like kind of escape that like hospital and like get to see the world.
For the kids, it means a lot, but for the players, it does as well. They get to see, you know, some of the kids in the community and what they're going through.
Well done.
Okay, so the Padres spring.
So that was just a story that we got a lot of coverage on, just because we had the elements that we needed. We had the patients, we had the Padres, we had our CEO out there, and it was a visual story where kids got the opportunity to go to spring training. And so there you go. That was one of the earned media pieces that we pitched to television just a few weeks ago. So the media landscape, obviously, for those who understand and know the media, it's quickly changing. Reporters have very little time to really dig on a story. They're always seeking a second opinion or another expert for their story. They will always oftentimes seek other folks to be part of the story. So it's always good to kind of educate the reporter about what the story is, what you think the angle might be, so that you guys can meet halfway and do a decent story. But sometimes reporters are doing negative stories on your agency per se. And so you want to be able to really balance out that story as well to supply the important information that you need as well. Regionally, we have one major newspaper, that's the San Diego Union Tribune, that many of you know is shrinking by the minute. So they used to have a beautiful building in downtown San Diego. they no longer have that. It's now reporters working remotely with a very small staff. We have, 7, 8 different TV stations. Univision in Spanish, Telemundo, NBC, CBS, ABC, and Fox are sort of the networks that work in this market. We have one major radio station, that's KPBS. They do both TV and radio. And then, you have those locals that include like the San Diego Business Journals, the San Diego Magazines, and the hyper locals, which include the Patches, La Jolla Lights, Rancho Santa Fe's, the Poway Chieftain. So depending on where your story is, you could always pitch to those hyper local outlets. If your story is, for example, connected to Chula Vista, the Chula Vista Star, or in Poway or Rancho Santa Fe, you could always pitch to that to make it more local. But usually, you really want to go out for the big papers like the Union Tribune and KPBS and some of the TV outlets. And of course, the broadcast, as you saw, I showed you that piece, they're looking for the visual story. If you don't have those visual components, then it makes it very hard to pitch a story and for them to cover it. So you want to have visuals. What makes a good broadcast story? Children, animals, and something that is controversial or even sexy, like celebrities, anything that's juicy and spicy. They want that. They want that. So the outlets are always looking for that. The big networks, CNN, CBS News, NBC News. There's also those trade journals. I work a lot with some of these: Cardiology Today, Healthcare Leaders, Hospital Review, because I'm a hospital, so that's typically where those trade journals that I have to work with. But they also want the patient component, any studies, anything that's new, that has new numbers, statistics. So that's what they're looking for. And preparing for the interview is very important, right? So what I do is typically I always sit down with my person who's going to be doing the interview to prepare them. I don't let them go to an interview cold, even if it's a radio interview or a phone interview. I always sit with them. But one of the objectives that you should know is what we call SACO. It's a single overriding communication objective. And that basically would mean your 3 or 4 key talking points that you can go back in case the interview starts getting a little difficult. You could always go back to your SACO. As I just said, these are my key talking points for this interview. So a SACO is really the importance drive, what's going to drive your interview, that you want your speaker to stay on, because if they deviate from that SACO, the interview can go in many different directions. What do you want to achieve from that interview? What's your key message, right? What are your SACO? What is your SACO? What's the key messages that you want to portray to the community and to your interview that you're doing? You want to basically prepare and research. You want to understand who's calling you, what reporter's calling you, maybe understand the reporter's objectives or point of view, read some of the recent articles. So for example, the new healthcare reporter at KPBS just arrived. She sent me an email and wants to do stories. So the first thing I did as a PIO for a major hospital is I Googled her. I want to see what type of stories she has done, what stories she has written on, so that I can kind of feel her out and know how to be able to pitch stories and understand that if she's a controversial reporter, then maybe I may want to stay away from her. So that's always a good idea to research the publication, the outlet, the television station, to get a better feel of what they have written about in the past, and if they've written any stories about your agency or organization. And again, know your 3 key messages, as I talked about: the SACO, the single overriding communication objective. That's going to be key. If you don't have a SACO when you go into an interview, then you might as well kiss that interview goodbye, because that reporter can hijack your interview. So if you have your 3 key messages, 4 key messages ready and on hand, then that's going to save you from maybe a difficult interview. Have sound bites. In television news, we talk in sound bites, 10, 15 seconds. That's the message that you really want to get out. Don't make your interviews too complicated, too technical, because if you do, then it's not going to work out. You're going to have a lot more questions than you're going to have answers. And, you want to have facts and examples. The rate of tobacco in San Diego County is increasing by this %. This is the agency that did some research on this. That's an example of what I'm talking about. You want to be able to give statistics and back them up with some good sources. Any questions so far? I know that I've covered a lot in the first 15 minutes, but I know there's some questions out there. I want to open it up for questions as well. This is an
Carlos,
interactive. Go ahead.
are you able to share your PowerPoint with everyone, or to us?
Yes, I could do that afterwards.
So I just want to, give you a little background on what we do. I know you know what we do, but we focus on substance use prevention, harm reduction. So what are some of the things we need to consider when we try to pitch a substance use related story to a place like Rady?
Pitch it to Rady, you mean?
Yeah, like, what we went through with the edible issue, or if we're
Oh
working-
yeah. It's always good to have someone who's been impacted by this. I know it's difficult. We've talked about this, Joe, having that human face element, someone who's going to really go and say, yeah, this is true. I was a victim of this, or I was part of this, or I was involved with this, or this is how it impacted my life. So when you're pitching stories, or when you're getting involved with another agency like Joe and I did for the edibles with one of our doctors, it's always good. I think we talked about it, Joe, that there was that press conference, but you always want to get as close as possible to have that human element, someone who's been impacted by it, because that's really going to help you sell the story and get media coverage.
Right.
Now, it's good that you have great numbers and the media may cover you, but that may not give you that full coverage that you want. So having that human element to it, human face to it, will really make the story a lot bigger.
Any other questions? I have one other, and then I'll
Yeah.
let you go on.
Yes, go ahead.
What I find really interesting are those healthcare journals. When we are pitching to a healthcare journal, is there anything other than a personal story we need to remember?
The journals are a little different. They want that element, but they're more focused on like the organization. They want research, anything that's researchy, anything that's new, and it's a lot harder to develop a relationship with the journals, just because they don't write about you every single day like the Union Tribune would. But it's always good. Every, law enforcement has journals and publications. You can pitch that kind of stuff to the stuff that you're doing to those kind of journals as well. Healthcare has their journals. The district attorney has their journals and publications that focus on writing just about those topics. So many journals out there for depending on what you're doing and what your agency does. But yeah, it's always a good idea to pitch them, because it's an extra set of eyes that you probably won't be able to get through like the Union Tribune or KPBS.
One other, and then I'll let you go on. This is from Tara. Do you propose sending paper, media advisories in paper, or should it all be digital?
It's all digital.
all
The
digital.
the days of faxing are over. The
Yeah.
news stations I don't think have faxes anymore, but
Yeah.
it's always a good idea to pitch to the news stations digitally and follow up. Always a good idea if you have a good story to pitch it just a few days. If it's a deadline heavy, where you're going to do it on this date, pitch it just a few days and follow up and just say, hey, I'm Carlos from Rady Children's, wanted to follow up to see if you got my media advisory. That way it will give you a better idea of when you're having a news conference or an event, that you have an idea of who may be attending.
Okay, great. We'll let you go on with the rest of the presentation.
Thank you, Joe. The interview process also includes the different reporter styles. I have found over the years that I think that there are 4 different style of reporters, whether it's print or radio or television. And I think you can kind of read through this. I won't go it by reading it, but there's that stare, that reporter that when they show up to an interview, they kind of let you control the interview. They're just kind of staring at you and really no engagement. They don't agree or disagree with you. They're just not really the seasoned reporter. They're not the reporter that's going to give you any feedback. It's just they let you control the interview. You get a lot of those, especially the younger reporters that are coming to San Diego and television news. As I mentioned, the television world is a lot bigger than the print. Newspaper is really shrinking. You get that aggressor, you get that reporter that comes in swinging. They kind of have an opinion about everything, and that reporter that's going to be just kind of more in your face and ask you difficult questions. Then you have that reporter that's that intellectual. They know everything. They've been everything. They've done everything. And you can't really compete with them. They don't really listen to when you're giving your interview, and they're always interjecting. And then you have that ignorant reporter that just doesn't understand the story. You could explain to them. I had a story. I had a reporter. I won't say who it is here in San Diego. We were doing a story about a kid who got a heart transplant. Now we all know that a heart transplant requires someone to get a new heart, correct? And this young reporter, came and asked my cardiac surgeon a very dumb question, and she said, "Is it just getting a heart transplant is the same thing as like removing their heart?" And I mean, like, how could a reporter say that, when we're doing a story about a heart transplant? So you get the reporters that just don't understand the full story, and you have to kind of explain it to them. Typically, when a reporter comes to me and we're doing an event, a news conference, and I kind of greet them and get to know them, and I just tell them exactly what the story is so that they can have an idea, so they don't ask my doctors a dumb question, because he's a cardiac surgeon. He's a guy who removes hearts and put in new hearts. But the doctor pulled me to the side and said, "Don't ever bring that reporter back. She doesn't know what a heart surgery is, a heart procedure." So there you go. This is just an example of some of the kind of more or less reporters that we'll get in this market. There's the tough ones, like the Phil Blowers are tough. You got the easier ones. I could name a few good ones and bad ones, but for the most part, they're all good. I think we have Ron that has a question.
Not a question. It's I see black boxes all over my screen, and it's I can't see all the text. I'm not sure what that is.
Okay, there should only be a black one at the bottom for whatever reason.
There's one all the way to the right, and
Yeah.
do you see that, Joe?
Yeah, we had a little technical issue. We,
Okay.
for some reason, can't figure out how to get rid of those.
Yeah.
But when
I've
we
tried-
send the presentation to you, we promise that those won't be included in it.
Sorry about that,
All
Ron.
right, thank you. No, I forgive you. That's not the worst thing's ever gone wrong with me. Tell you,
But I hope you're enjoying the presentation. I apologize.
I am. This has been incredible. I've had every one of those in front of me interviewing me, and
Yeah, I mean, correct. I mean, so Ron, you agree. I don't know where you work at. Where do you work?
North Inland Substance Use Prevention, and we'll get in front of them, and some of them have no idea why they're there. They were just, it seems like they were just dispatched there to go take B-roll, and they want you to just go on, and then others will interview you and say, well, what does that mean? And like I'm like, I just said peanut butter and jelly.
Yeah, I mean, so you've experienced that, Ron. So you get those that just come and just like, okay, can you blink? I don't know if you're reading me, or can I read you? Or you get those really aggressive reporters that are asking you those very difficult questions sometimes.
And it's very tempting with the person staring to just like fill the void, like with more stuff until I get a reaction. And boy, that's a tough one.
Yeah, so that's kind of the styles of reporters that I think that do exist nowadays, and it's you just have to understand them and know what their style is, and it's always good to research, Ron, just so that you know who's covering you, and that way you can kind of feel them out. For the most part, if you're dealing with media on a daily basis, you kind of know who these reporters are, and you can kind of tailor to their needs so that it will make your experience with them a lot easier. As a public information officer, I will tell you that I'm always there every time I'm doing an interview, just because our experts aren't media trained fully, and so I want to make sure that if the interview is going in a different direction, or they're asking those dumb questions, as I said, you're there to kind of bring it back and drive it back home, so that the person who's being interviewed doesn't have a bad experience. Because you'll always get, well, I was misquoted. Well, you can't be misquoted in television, but in print you may. It's just a little difficult. So, but thanks for sharing that, Ron. Any other thoughts, suggestions about reporter styles? Because we've all dealt with them more or less. Right, Joe? You have too, right?
Yeah, I mean, we just had a comment, like, it seems like they send one camera, they rush in, they rush out, There's a lot of times too, when, we have kids come in and speak, and they plan for months, and then the story doesn't show up at all, and they're really let down. So, that always is sort of a pain in the neck a little bit, The kids are practicing and doing spokesperson training, and then it doesn't even make a 5-minute blip on the news.
Yeah, as I mentioned, and I removed the video screen, Joe, so I can't see any questions, so just feel free to chime in. But if they go out and cover you, and you don't see it that night or the next morning, that basically means they didn't run the piece. And so it is frustrating. But you could always ask, what time is this airing, or is this going to be online? As you know, the media world is shrinking, television is shrinking. So it used to be you would get reporters that would cover you, but now that's not the case. They're sending what they call multimedia journalists. It's typically a reporter who does the editing and shoots everything and puts everything together, or you get a photographer who they're not the smartest, right? They're not the most savviest people. They're covering 4 or 5 different stories a day. So you as a media representative have to educate them a little bit and tell them what the story is so that they can understand. So that's typically it. So the types of interviews, sometimes, as Joe just mentioned, they come and cover you for 15, 20 minutes and you're like, where's that interview? It never aired. Usually they call you in advance and plan it. There's not that many more. Zoom interviews aren't really happening like they were during the pandemic. It's very rare now when a television station wants to do a Zoom. They still do them, but it's not as it was before. Obviously, newspaper print interviews are still done over the phone. Sometimes, they have an urgent tone. They want it right now, and sometimes it's difficult to get someone right now, just because they don't understand our deadlines, and sometimes we don't understand their deadlines. So just understanding how the urgency of the story is and what they want is always important. Then there's feature interviews. Sometimes they come and sit for half hour to half a day and do interviews, and then they cut it down to a 2-minute piece. You have to understand that, if you sit there for 30 minutes, they're not going to air 30 minutes of interview. So keep that in mind. They usually have a softer tone, and it's planned, and they give you sort of a narrative of what they're doing. Then we talked about those quick turnarounds. Sometimes they come 5, 10, 15 minutes. They cover you one interview, and then they're done, and it becomes a 40 to a minute piece on TV. And they're just kind of looking for some color for a story that they're running on, Mother's Day, or they're looking for a story on Autism Awareness Month or something like that. That's just usually what that quick turnaround means. And then you have the broadcast piece as well. Any questions so far, Joe?
Just sort of another comment from Ann Moss, is, sometimes a reporter was just dispatched by an editor or a producer who calls the reporter with only the time and place. That usually happens because a reporter who was assigned to cover something was diverted to cover major breaking news, and was delayed on the story, or any number of things. I've been that reporter who jumped in at the last minute and had to ask what an event is about.
Yeah, so that happens a lot where, you have a press conference on the edibles, for example, that when we did, and then a reporter wasn't assigned, but all of a sudden that major breaking news story didn't happen. So it's like, go to Joe and his team. They have a press conference at 10:30 now. And so they have very little information to go by. And so, it's your job as a media PIO, public information communications director, to, when that reporter shows up and says, hey, here's the media advisory. Do you have any questions? And, it's your opportunity to really control that interview and educate that reporter, because again, sometimes they don't know where they're going. They just get told, go to the 10:30 presser at the county with Rady Children's and Joe's team to go cover this. And they have no clue what it is.
Yeah.
So yes, it happens a lot.
Okay. That's
The
the comment.
Yeah, the expectations, expect to be edited. It will always happen. Most interviews for news result in just a few sentences being used for the newscast, or even, Dr. So-and-so at Rady Children said heart transplants are on the rise now in San Diego, and they have a quick interview with him. Sometimes don't expect to be part of the whole entire story. You may be a quote. They may be talking to several people. They may be talking to people at the county. They may be talking to someone at Rady Children's. They may be talking to someone else. So you may be one of several people. So it's always a good idea to ask the reporter, are you talking to anyone else about this story? So that sometimes you don't want to be the bad person giving the bad story. So keep that in mind as well. And as I just said, expect other people to be part of it as well. And sometimes they may not use that interview, as Joe said. It's disappointing, but it happens, and you can't really call the media out, because if you do, then you're kind of burning bridges. Sometimes they just didn't have time. It was too heavy on sound bites, as they say, and they need to remove someone. So, it was a doctor from Rady Children's, and it happens to us as well. And it's frustrating, but you have to go back to those folks and say, well, it was cut for whatever reason. And you just kind of move on and don't make a big deal out of it. Interviews best practices. A question is simply an invitation to speak, right? If I call you and say, hey, I would like a soundbite on the increase in marijuana use among teens in San Diego. Well, that's an invitation for you to speak about it if you think it's appropriate. You always want to allow the reporter to finish their question or comment before interjecting or jumping in. Sometimes it's the other way. Sometimes you're not even done with your answer and the reporter is interjecting. A good way to bring that back home is simply say, I wasn't done with my thought. I think it's important for me to say this or continue to what I'm wrapping up to say, because that reporter will stop doing that. A lot of reporters tend to do that a lot, to interject if they feel that the interview isn't going where they want it to go. Remember, when a reporter asks you a question, think about it real quick. Don't pause too much, because if you pause, start thinking about the question as it's coming to you, but don't spend too much time thinking about it, because if you do, then it's an opportunity for that reporter to interject. Be concise and deliver relevant information. Again, don't be too technical about your response, because if it becomes too technical, then that reporter may not understand what you just said. And when they go back to look at that soundbite, that interview, they may not use it because it wasn't very clear. You want to stay in the driver's seat, right? You always want to be in control. Keep in mind that your primary concern, my primary concern as a PIO, is for the hospital and to promote the hospital and to promote our employees or patients or partnerships and the community, right? So we're going to speak about the hospital. You're going to speak about your agency, your organization. You never want to kind of second guess or give an opinion about a different organization. We never want to talk about the county. We never want to talk about another hospital, just because it's just not appropriate. And you want to maintain that positive relationship. You want to stay in the driver's seat and stay focused on the interview that involves, for example, in my case, the hospital. And you want to always frame your answers, and remember, don't make them too technical. You want to make them simple for people to understand, because if you start talking too technical, if you start getting into the weeds of whatever topic you're talking about, people may just not understand. So you have to keep it very simple. Every word you say will end up in print or broadcast, right? There's no such thing as off the record. Remember that. You do not talk to a reporter and say, well, off the record, I just want to tell you, Joe's a bad leader. You just don't want to do that, because it's going to come back and haunt you. You're the one that has that relationship with the reporter. So you don't want someone's sources close to the story said this. You don't want to do that. It will come back and bite you. Believe me. Everyone knows that you're the one that has a relationship with the media as a PIO or a communications. So saying something off the record about someone or something may not be a good thing. They're going to come back and say, you are the one that said it. No comment. You just never want to say no comment. You want to stay away from that. It's evasive. You simply say, that's a good question. I don't have an answer to it. Let me get back to you. Or, we don't know exactly what the outcome is of that investigation at this point. But what I can tell you, as I've said, the SACO, the single overriding communication objective. But what I want to tell you right now is your SACO, those 3 talking points. You want to go back to your SACO whenever you're in a no comment situation. If you don't know the answer to a question, just say, I don't know the answer, but I can get back to you, or let me get the experts, or let me talk to the people who are doing the research, or the people who are out in the community talking about this, or speaking to parents about this, so that I can give you a very clear answer. And once you give the answer, don't feel compelled to continue speaking just because you need to speak. You're done, you're done. Sometimes you say the wrong thing just by continuing to talk, just because you think you want to fill a silence. Just some more interview practice, best practices that I think that you should know about. If a reporter makes a mistake, it's okay to correct them. It's okay to say, hey, you may not have that correct information. here is the right information. This is what you should know. Or let me give you the latest information of what is out there. Here are some other best practices. I won't go through every single one of them, but in our case that we work in healthcare and deal with patients and all that stuff, privacy obviously is important. And in our case, HIPAA, but reporters don't know what HIPAA is. So it's your job to educate them, say, there's privacy rules around this. I can't really give you names of patients or why they're at the hospital. Because my job is to protect them. So you have to educate them on what these laws are because they don't understand it. Any questions about the media relations part? I know that I talked a lot about it. I know that there could be some questions of experiences or folks that have gone through anything.
I have a question, Carlos.
Yeah, Joe.
Are you basically the final say in what Rady's gets involved in media-wise? And what is your team like?
Great question. So the media relations team is composed of one, that is me. So I handle all the media inquiries and I'm the one that's doing all the pitching. So again, sometimes we may get a story that may be a bit controversial or a story that we just don't want to be part of. Sometimes there's laws going around or things involving the county. And obviously, because we have strong partnerships with the county, we have to be very careful. So sometimes we have to say, no, we're not going to be part of that story just because we don't want to upset our counterparts or our community partners. Again, the media relations team is composed of me, and so I'm the day-to-day guy at Rady Children's dealing with media. So that's why I say off the record, everyone knows that I'm the one that deals with the media. So if I ever say off the record, someone's going to say, well, it was Carlos that said that because he's the only one that knows reporters.
Yeah.
So typically, we have a strict policy of anyone speaking to the media, whether it's our CEO or any of our executives or employees, they kind of have to go through me first. And so I can vet the media outlet and make sure that we're not working with them on something else so that we can continue our positive working relationship.
Great. I don't think we have any questions yet, but I know I'm very interested in the social media for Rady. Wait, Ron has a question.
Yeah, Ron.
I got unmute here. Carlos, could you comment on written responses or presentations versus something that's well prepared and extemporaneous?
So give me an example of a scenario of what you're talking about.
So you show up with what I see on the news is people reading stuff off of the podium. And it's obvious that it's just as well scripted. That can seem a little disingenuous and maybe not even that person's opinion, or it's not real authentic. And it's just one person after another on that thing. And then someone will get in and it's like they're not talking from notes, but they're well prepared, more of an extemporaneous presentation.
So I think what you're talking about is like a news conference type setting, or there's a media event and you have a podium, right? So yeah, that typically is always scripted, and you're right, it doesn't sound genuine, right? It doesn't sound real. It's very scripted talking points, and there's no room for error, correct? So sometimes when there's a press conference, reporters, I can guarantee you most of the time, reporters will always say, can I talk to you, Ron, one-on-one about this topic today? And you say, sure. And then they're going to ask you more or less, they've heard the presentation. So now what they're going to do is ask you, as you just said a few minutes ago, the rate of marijuana increases in high schools. What can you say about that? Now you're going to say, well, yeah, we are seeing more kids smoking pot in high schools around San Diego County now. So that was more authentic, and it didn't sound scripted, and you came across as real versus a computer or robotic interview, right?
Or like I talked to an emergency room doctor that told me they're seeing much more presence of THC overdose in the emergency room.
Yeah.
So rather than saying the numbers, because numbers just, I mean, it really for people that love numbers, it's great. But for people who want to hear a story, it seems to go flat.
Yeah. So one way to answer that is simply saying, yeah, speaking to emergency room doctors across San Diego County, we're seeing that just last month alone, there was 150 kids who were brought to Rady Children's just on drug overdoses. So that number seems to be increasing, and it's important for us to get that message out. So I just gave you a 15, 20-minute soundbite, and I sounded real versus kind of scripted.
Right.
Great question.
You can't fake real.
Yeah, you can't fake real. Great. Any other questions, Joe? Do you have questions, Joe, or no?
No, no questions.
Okay, perfect. So social media, what is your goal, right? You have more control on the message when it's a social media. So what do you want to be on social media? You can control what's on your social media platforms, whether it's Facebook, Instagram, whether it's X, Twitter, or TikTok. A lot of government agencies don't have TikTok. We don't have TikTok, but some people do. So it's important to get that message out to your network to really expand to the community, and you can control that message on what you want to get out there versus doing a media event. It's important to share your research findings on social media. That's always good. And you're also reaching some of your own patients to let them know what research findings you're doing, what research events that are happening within your organization. So it's always good if you're looking for patients to participate in something. It's always good to go through social media. Believe me, they will come to you. So you want to determine what the goal is. Social media allows you to define the audience. You can select a platform. You can develop the voice for your organization, and you're getting community engagement. You're involving the community. So here are some of the platforms that exist. We only use LinkedIn, Instagram, and Facebook at Rady Children's. We don't engage with Twitter anymore, and we don't engage with TikTok. But LinkedIn obviously is a great way to reach out to professionals, that group of people that may not be on Instagram and Facebook. For example, we put out at Rady Children's research results, articles, blogs from stories about doctors and patients, videos, photos of events. That's what we put out on LinkedIn. On Instagram, it's typically the audience would be parents. The average use 31.7 of the US users are between 25 and 34. That number may have changed from maybe just a few months ago, but it's a great way to engage with the community. They love visuals, the reels, the photos, the stories. By the way, if you want to follow us on LinkedIn and Instagram, it's at Rady Children's. We push out a lot of content, and it's great. We get a lot of good results from it. We put, for example, March is sleep month, so we pushed out a lot of sleep ideas and information from our sleep doctors. We did some reels. We post our stories that we do on media. We post them on LinkedIn and Instagram and Facebook. Facebook, obviously, it's a little older audience, grandparents, parents. Typically, users are over the age of 45 or so. But again, it's a great way to get educational information out there, videos, stories, photos, anything that the media may not be able to pick up. It's a great opportunity. Ron.
Could you talk about in social media of tactically tagging to help achieve a strategy or strategic goals?
So tagging like other organizations, you mean?
People that might be in that particular thing that you're talking about, or people that might be that you've worked collegially around this particular project.
Yeah, great. That's a great actual point that I kind of missed, but it's important to really tag. For example, if we're doing stuff with Joe's organization and they are on social media, it's a great way to tag them. If we're doing stuff with the county in a partnership with the county, it's always a good idea to tag them. If, for example, every year during Autism Awareness Month in April, they light up the county building a certain color to raise awareness for autism. So we go out and take a picture, we tag it on our social media platform, and we tag our county partners, because it's a way to say thank you, and they get the views and we get the views. So it's always a good idea to tag folks if it's a positive story. Obviously, if it's a negative story, you don't want to tag anyone, right?
Right.
But for something that's positive, that's the cool pictures. If we're partnering with another nonprofit that we always do, the YMCA or any other on whatever topic that is, we definitely want to tag him so that they're also getting the credit as well.
And the twin sibling of tagging is sharing. Do you do that a lot at Rady's? Share things that other people?
Yeah, correct. We share with, for example, we did some stuff with the Loyal, and we've done some stuff with the Padres. You know, when we did that Padre partnership, they wrote a tweet. So, you know, we normally don't do Twitter, but we have an account, so we just went out and shared it, and that's another way of engaging and keeping the conversation going. LinkedIn, we do the same. Instagram, we do the same. I think a lot more people are picking up LinkedIn as another social media platform where you can share information. It was always Instagram, Facebook, and Twitter. But you know, I'm noticing more and more people are picking up on LinkedIn because it's a different crowd. It may be the crowd that isn't on Instagram or the crowd that isn't on Twitter or on Facebook. And it's also important to reach out to them because they may not know about your organization. In fact, we just did a big story on the New York Times about Kawasaki disease. It's a condition that impacts young kids, and if they don't get treated fast enough, they start to have cardiac conditions down the road. Well, our team put the story on LinkedIn, and someone saw it in New York and gave us $10,000 for this program. So there you go. Otherwise, if we hadn't put it on LinkedIn, no one would have given us $10,000. They gave our Kawasaki disease research program $10,000 to continue the research, which is good. So you never know what's going to come your way. We did a story in the UT a few years ago on our new cardiac program that we have, and cardiac intervention program where they do cool stuff with kids and their heart procedures. And someone donated $1 million because it went on LinkedIn. Someone just saw the story and wanted to be a donor and donate to this program. So you never know what could come out of it. Of course, for us, it's a little different because we're a children's hospital, and you know, we depend a lot on philanthropy. But putting stuff out there could lead to donations in our case. Social media's do's and don'ts, right? You always want to post regularly in quality content. You want to make sure that sometimes there has videos or photos because that's going to help increase engagement. People really like photos and pictures, right? And you also want to reply to the comments very fast within a day or so. You don't want to just leave those comments hanging on, because sometimes people have legitimate reasons to give a comment, right? And you want to engage those people and make sure that their concerns are addressed. Whether it's just putting a heart to the comment or just saying thank you, or we will relay the message to the doctor, something simple. That means a lot to people. And obviously you don't want to just remove comments for the sake of removing them, but if it's offensive, if it doesn't fit with your social media policy, if it's insulting someone, you definitely want to remove those. But just because someone says, I don't like Rady Children's Hospital, well, they're entitled to say that, because if you start removing those kind of comments, guess what's going to happen? They're going to come back. So sometimes it's just better to kind of leave them there and just kind of gauge what the engagement is to figure out should it be removed or not. And again, you know, in our case, we don't talk about alcohol, drugs, or weapons or anything to that nature, just because we are a children's hospital. We have to be very careful what we put out on our social media platforms. You know, there are some considerations you really want to look at before posting. You know, we have doctors that sometimes go rogue and are social media influencers and kind of do a lot of social media on their TikTok. And, you know, we have to make sure we follow those to make sure that, hey, you know, you may be posting on Rady Children's Time, or that's not part of our message that we want to get out to the community. So you have to be very careful, because our reputation and the organization's reputation is important. We did have a doctor that goes rogue, and you know, she got her hand slapped for kind of doing social media topics on psychiatry topics on some of the topics that are kind of sensitive. And so, you know, she got her hand slapped for kind of posting on her TikTok, and you know, she was doing it on Rady Children's Time and wearing Rady Children's logo wear. And so it makes it sound like it's Rady Children's that's sending out that message, but it wasn't us. So, you have to be very careful. You know, TikTok is another whole conversation. It's got its own security and privacy issues, and so we don't really touch it. We have an account just to follow, but we don't post on it. It's kind of a generic account, not affiliated with Rady. It's one of someone on our team that manages it in case we want to see what those doctors are saying or what have you. Ron, I think you had a question.
Yeah. So, the idea of I can't ever not be an ambassador of Turn Behavioral Health Service, even when I'm off the clock, and even though I might want to come in. And the saying is if it came from someone from the office, it came from the office.
Yeah,
Yeah.
exactly. So it comes back to your organization's reputation. In this case, this doctor who's a dear friend of mine, I had to tell her, like, you can't do this. You can't wear the Rady Children's logo where I know it's your own TikTok account, but people are not seeing you. They're seeing the Rady Children's logo on her white jacket, or coat that she wears. And so they're immediately saying, oh, that's Rady Children's saying that. So it's all about your organization's reputation at that point, and you just have to be very careful. So even like you mentioned, Ron, I mean, you work in that field, you have to be very careful because someone at the county level might see that and say, well, Ron was talking about this. And it may not be in conjunction with your organization's message. Any questions so far? I think that kind of wraps up the PowerPoint. I could stop sharing.
Thank you so much, Carlos. I do have a question because I know you work with a lot of Spanish language media. And I know Miriam's on the call, which I'm happy to see. Miriam is our translator, and one of the things that Miriam does is translate the media advisory into conversational Spanish as opposed to the proper fluent Spanish that you would get in 11th grade high school. So, can you tell us, what are the best practices in terms of that?
Yeah, you bring up a very good point. We live so close to the border, and so we just have to be very careful that, it may give you a certain translation, but that's not how folks say it around here in San Diego or wherever you're at. But you just have to be very careful, especially with AI right now, where you can just plug things in and it gives you a certain word and you're like, whoa, that's not exactly how you say it. So be careful what you send out. Make sure you review it. Make sure even for it's English or Spanish, and you use AI to write a media advisory. It may not be the exact word you're looking for. It may be the wrong word, and now you open a can of worms. So just give it a second look, Miriam, and make sure that it flows with our general market here in San Diego, and it's the way they sort of speak.
Miriam always gets the translation right. I know we've had speakers at CCR, but it's too proper.
Yeah.
Anytime Miriam does it, it's always no problem. So hats off to Miriam. I do have another question. As media advocates in the substance use field, what are some types of things that will be flagged at Rady's as we can't get involved in? Can you give us any examples?
Good question. There was that event that I'm thinking it goes back to that event we were trying to put together where we couldn't have it at Rady. Can you remind me what it was? Because it was a little too political.
Yeah.
And I think that's when we moved it over to your office. I don't remember what it was, but that's a good example, Joe. You may remember that because we're like, oh, we can't do it at Rady because it's going to upset people.
Anything related to fentanyl or anything like that? We do get asked, like, what happened to that patient? Why can't we get information? And you talked about HIPAA. You really can't say, well, Mr. Smith is in the hospital for 2 weeks and here's his medical record. You can't really say that.
No. Yeah, no, I think, Joe and our team were and his organization, we were planning on having a media event at Rady Children's, but it was a little too controversial when that topic was first coming out. And we were going to do a press conference at Rady Children's, and we opted not to, and it became sort of a neutral place because we didn't want Rady Children's to be like the center of that conversation. Was it fentanyl or marijuana?
I think it was regarding marijuana, and I think you were, a little worried about the legality of marijuana and, calling out the industry per se.
Yes, that's what it was.
And, you know, we were trying, even with the talking points, we didn't want to go there, you know, so.
Yeah, in fact, you know, there is a new reporter in town by the name of Jim Avila. I
Yeah.
don't know if you guys know. Yeah, you know who he is.
Yep.
Jim Avila was a network reporter at ABC News for years, and you know, very well respected investigative journalist. Very nice guy. But again, he could be a nice guy, but he's an investigative reporter at the end of the day. So he came to San Diego. He works at Channel 10, and Jim Avila was interested in interviewing one of our doctors, Natalie Lobb, who is works closely with Joe and team. And we really had to sit down, and we actually met with him to figure out what direction he was really going to go with the story. We had to get a lot of permission to make sure it was okay for Natalie to talk to him, because he was point blank attacking the industry, the marijuana industry. And so the story didn't come across as harsh as I thought it was. I think it was fair and balanced, but it's not always going to be like that. So Jim, you know, really have to be very careful. At the end of the day, he's an investigative reporter. And so at the end of the day, when he's done with your story, he's done. And you could face the legalities and the repercussions of that story. Did you talk to him, Joe? Did your team talk to him?
Yes, we sat down and he was pretty unsure of whether the last two parts were going to even air. He said that in his career, he never had such pushback regarding a story, you know, and he has an extensive career. So even ABC 10 was sort of worried about where it was going.
Yeah, the work that your team and the others on here do is important, but at the same time, you have to be very sensitive.
Yeah.
You know, we have one doctor, Natalie Lobb, who's working on fentanyl and doing a lot of work around a lot of this great stuff that you guys are doing. But at the end of the day, you just don't want to get sued. You don't want the big names to come after you because you said something that may be inflammatory. So you have to be very careful. At the end of the day, Jim Avila is not going to come and protect us.
Yeah.
Great guy.
No, that's a good point. Let's go to questions, Ron.
Yeah, it seems like I'm the questionnaire, so anyone wants to know who asked the question, it was Ron. So I can't say I didn't ask the question. So you brought up AI and there's a lot in the news and around AI as infringing on copyrights of intellectual property and etc., to the point that, so do you have any cautionary tales about AI and how it can like come backwards?
Well, you know, Joe, sorry, Ron, it's so new and it's changing by the minute, right? It's like when social media first came on and people were afraid to do it because it was so new. AI is so new that it's changing. I can tell you in healthcare, we don't really use it just yet, even Chat GPT or anything like that, just because it's so new and one little mistake can really burn you. So we're not really using it at Rady Children's. I know that some healthcare organizations are. I know law enforcement uses it a lot. So it's hard for me to comment because I'm not really involved in it yet. I'm sure that I'm going to have to learn it very, very fast. I mean, I've seen friends use it at other hospitals. I know a friend in Miami is using it at one of the hospitals out there. They sent out a news advisory, but it gave them some wrong information. They just assumed it was going to be right, and they just sent it out without checking it. So again, it's one of those things that's evolving. It's changing so fast that you don't know which direction it's going in.
So then again, last question is, with social media, because that's what this is about. Are there times, and maybe if you describe it, that you worked collaboratively with someone and they posted it and you shared it, or you shared it and they posted it in some sort of a collaborative arrangement there, or did that work or not?
Using AI or just in general? Like,
we're coming up with a story, maybe using AI, any of your other research, and then they post it and you share it, or you share it, post it and they share it, or you post it and they comment. Is there any collaborative work that you've done to help kind of collaboratively like, okay, I'm going to post it. I'm going to need you to comment on it.
Yeah, well, we work a lot with a lot of nonprofits and other groups, right? But I don't think I've had to face the AI world just yet, from what I am doing, because we kind of are not, we haven't embraced it at Rady Children's, and I think we're just being very cautious. We're very conservative, so we don't want to jump the gun just because everyone else is jumping on it. I know it's a thing that we should start using, but I think we're just not ready. That's a good point. I haven't asked the other folks if
Mhm.
they're using AI to write a social copy or even a media advisory. So I guess I have to start asking, because I didn't think about that, right?
Yeah, I'm not asking about machine learning because
Okay.
every industry is using machine learning,
Yes.
it seems.
Yeah.
But AI is a machine learning
Yeah.
device that we can capture. I mean, you can research everything that's ever been printed
Yes.
on something in a few minutes.
Yeah. You know, if I was in that situation, I would maybe want to double check whatever they're sending out, because we're not using it. But that's a good question. I don't know if the other folks
Yeah.
are using AI to develop that. So if they are, I think I need to just start checking on that and double checking, because
Yeah. And you can ask AI and cite text that you're taking this from, and it will.
Yeah.
So it will. So you can decide whether it's a citing or whether they're just it's reporting what somebody else reported, because that sometimes isn't a very good citing.
Right, it's not a good citing.
All right, thank you.
Good point.
Carlos, because you're gonna be connecting with Chalk, does that mean you're gonna be the media guy for both?
No, so if the merge does happen, they are merging with Rady Children's, and
Okay.
you know, everything is still in the works right now. We're waiting for the Attorney General to really make that decision if this is going to move forward or not. It's sort of still in the up in the air as to exactly what's going to happen. But from what I understand and what we know right now is that both hospitals will be two separate hospitals. Rady Children's will be one and Chalk will be another. They're still, excuse me, deciding on what the name will be for the parent company, which I believe it will be Rady Health. So Rady Health will be our parent company, and then there will be 3 children's hospitals among that health system. So
Wow.
we are moving into a healthcare system versus a hospital, what we are now. So kind of like a Scripps, where they have all these hospitals, and Scripps
Yeah.
Health is their parent company, and then you have Scripps Mercy and Scripps La Jolla, Encinitas, and Chula Vista.
Hey, before you go, Carlos, on the AI, somebody asked about recommended trainings. I don't know any, but I will say, you said it's very young. It is functionally a 4-year-old. So just know you're working with a 4-year-old, and it was a long time before Facebook got to be a teenager even.
Yeah, you're right. No, it's that whole system program is changing by the minute. I know that I talk to people who are using it, and then they're like, "Oh, what I was doing 2 weeks ago doesn't work now. It's a little different." So it's very difficult. I think a lot of government agencies, some of them are using them. I know that I was in Solano County, and I heard some people there talking about how they're using it, and I'm like, wow, that's interesting. I know that folks push out messaging sometimes in the communications team and one of the agencies there, and it came back to bite them because it wasn't accurate.
Yeah.
So you have to be very careful with AI.
Well, in the interest of time, it's 11:04. Carlos, are you okay with people sending, stuff, not all the time, but on occasion, just for you to read it and see if it's, ready for a healthcare institution, a media advisory, or to
Yeah.
offer some feedback?
Yeah, I think, do you have my email? I didn't know if it was cdelgado@rchsd.org, and I can put it in the chat.
Yeah,
I
or
think
maybe when you share your PowerPoint, you can put that in. I don't mean for everybody to bombard you with it, but you have so many years of doing this that I think it might help, some of us. And we have some new people in the prevention system, so, that might help us out.
Yeah, and the work that you guys are doing in the prevention world is incredible, because, I remember many years ago working with Jovita. Did she work for you guys?
Yeah, IPS.
And she was doing stuff with like the alcohol stuff in kids and the decoy program, and the media will cover you. And I remember covering it when I was a reporter at Channel 6. So there you go. I mean, the stuff that you're doing is important it's important for the community in both English and Spanish community. So if you can push that out to the media, they will cover it.
Yeah. Carlos, I really appreciate your genuineness of saying what you haven't done. I mean, because that that genuineness is really strong for us as a prevention circle. We started meeting in 2015 about social media. So, right now we're 9 years old I mean, not literally, but I mean, as far as us as the prevention units, we're 9 years old and we've not got to high school yet. So it's like, I mean, we've learned it fast, but it has been a fast ride too.
Well, thank you so much, Carlos. And I really enjoyed it. And I know we'll be collaborating in the future, and I wish you all the best. We will have the recording and the follow-up material sent out. I hope you all have a great week.